Hey there, I am Dr. Dennis Cheng. Welcome to my channel. Over the years, patients have told me they enjoy the way that I explain things to them about the eyes. Sometimes it can be quite mysterious for the eyes, and we all have these little myths and beliefs about our vision here. Luckily, most of them are not true. So hopefully these quick little informative video clips will help explain the eyes in an easier way to understand. And we'll start with the first one, which is glaucoma. So there are different forms of glaucoma. We're going to talk about the main one, and this is just a quick little video just to kind of help you understand what glaucoma is, how it's treated, and so forth. Glaucoma is an eye pressure disease. There is pressure inside your eye. Think of your eye as a self-filling water balloon. It produces its own liquid to keep the balloon inflated, and there is a drainage port to let the fluid out. So ideally, there's a nice balance between how much fluid is being produced and how much is draining out. And that nice balance creates just enough pressure to keep the eye nicely inflated. An analogy I would give patients is think of your faucet, your sink. The faucet is on, water is filling up the faucet. You have it at just the right rate of flow where water is filling up the sink but not overflowing, and just enough is draining out to prevent an overflow, but water is still coming in. You have this nice balance there. That's the right amount of pressure. On glaucoma patients, there is an imbalance. They either have too much fluid being produced or the fluid is not draining out fast enough. And what happens is the water builds up. That balloon of your eye is now overfilling. It increased fluid pressure. That pressure is damaging the back of your eyes. Another way to think of pressure is think of pressure like really strong waves. Okay, if you have really strong waves crashing against a beach, right? The amount of sand you have on the beach represents like how much nerve fibers you have. So if the waves are very strong, it's going to crash onto the beach, erode the sand. As you erode the sand, you're eroding your nerve fibers, and therefore you're losing the sand, you're losing nerve fibers, which leads to losing parts of your vision. If we can calm the waves down, so they're really gentle waves, then now you've lowered the pressure, and therefore you do not erode the sand, you do not erode the nerve fibers in the back of your eye. So that's a quick little explanation of what glaucoma is. High pressure causing erosion of nerves, which leads to peripheral vision loss. Glaucoma patients, they actually lose their side vision. They actually don't lose their middle vision just yet. They lose the peripheral vision first. And because it's so slow and gradual, you can't actually tell that it's happening. You need a series of tests over time to determine if anything has changed. It would be like if I asked you, hey, did I lose weight? And you're like, I don't know, I just met you today. Great, take a picture day one, see me in 90 days. Hey, did I lose weight? Yes, you actually gained 30 pounds. Wonderful, fantastic. So that's what we do. We do baseline information and data collection, and then we repeat the test in about 6 months to a year, and then see if anything has changed. And then as maintenance, you just keep getting these tests done about every year or so, just to make sure everything stays the same. As long as nothing is eroding, you're going to be fine. If they see some erosion, what they do is now they put you on medications to lower the pressure. So remember, those waves are really strong. The faucet is overfilling. If we can calm the waves down or reduce the fluid pressure or turn off the faucet, we're in good shape. So there are medications that patients take to reduce the pressure. Some of these medications reduce the amount of fluid being produced. So it's kind of like you're turning off the faucet a little bit, right? So now the sink won't overflow. Other medications make the fluid drain out faster, so you've basically opened up the drain on the sink so the water will flow out faster, and therefore you won't overfill the sink. So glaucoma patients take medications that do either of these two things, or sometimes in really bad cases they do take medications to treat all those things. They're lowering the pressure and they're increasing the fluid that's being drained out. All these things will ultimately lower the pressure. And that is glaucoma in a quick nutshell here. So it's not caused by computer work. It is not caused by, as far as we know, not caused by any dietary causes. There are like sort of anecdotes where people have gotten healthier, they've lost weight, and their eye pressures have decreased a little bit. But again, it's just anecdotes. If you want to get healthier and lose weight, go for it. And that is what glaucoma is. Hopefully that explains it a little bit better for you. Hopefully that makes a little bit more sense. If you or your family members have recently been diagnosed with glaucoma, know that it is not like a death sentence. The beauty now is we have amazing technology now. We can catch glaucoma early. We can treat it really, really well. If you catch it early and treat it, you don't lose your eyesight. It's really quite beautiful. It's the patients who don't get regular checkups and who don't take their medications. Those are the guys that really run into a lot of trouble. If certain patients are higher risk, generally African American men over the age of 40 are higher risk. Usually the more nearsighted you are, the higher risk you are as well. It doesn't always apply, but that's sort of like a general rule. Really far-sighted patients can also be at risk as well. If it's been a long time since you had an eye examination, always go get your eyes checked. You never know. Don't assume that because you see clearly that your eyes are actually healthy. That would be like assuming that my car runs and drives, therefore everything is fine inside the car, right? You can't do it. You have to do regular maintenance on your car. You should be doing regular maintenance on your eyes and your body. So, all right, thanks for watching my first YouTube video here. If there are any other topics you'd love me to explain to you, let me know. And I'll be sure to put out some more videos about things like cataracts and nearsightedness, astigmatism, farsightedness, presbyopia, which is when we start to lose our ability to read up close. So look out for those videos really soon. Take care.